My name is Ezekiel Oburu. I am an orthopedic surgeon at Nairobi Spine and Orthopedic Center, and today I'll be talking specifically about one of the conditions that affects the foot or the heel, and this is known as Achilles tendinitis. Now, there are two types of Achilles tendinitis. You can have what is known as insertional Achilles tendinitis. You can see that's the Achilles tendon there, or non-insertional Achilles tendinitis, and that's really the area up here. So insertional is where the Achilles tendon inserts, and non-insertional is just above there. So tendinitis, the tendon is inflamed. So usually these patients may complain of pain. If it's non-insertional, they will complain of pain around here. If it is insertional, they will complain of pain about where it inserts. I've seen this condition very many times, especially patients who've had it for long and really have had no diagnosis of the same. So when they come to me, they've been suffering for 3, 4, 5 years with the same. So what are the treatments that are available? Number of treatments that are available. Number one, if a patient has got non-insertional Achilles tendinitis, the patient can do eccentric stretching or eccentric stretching. And usually I tell them, hey, Google eccentric stretching and do those stretches. And that should be able to solve the problem. If a patient has got insertional tendinitis, apart from other non-operative measures, you may tell them to wear an open back shoe. These patients, when examined, may have a swelling over here known as a Hagland's deformity. Obviously, Getty does not have one, but if you examine, you will find in a patient with insertional that they may have a Hagland's deformity, which is actually a palpable even bump when you examine it. So after trying non-operative treatment, for a while, sometimes patients have gone on for 6 months to a year and really have not gotten better. What are the things that we can hope to do? Now, with regards to non-insertional Achilles tendinitis, really if non-operative treatment fails, you may just open the tendon sheath, expose the tendon through the skin, open the tendon sheath, go around the tendon, go around the tendon just below the paratendon, and you can stitch it back together. One of my teachers used to tell me that apart from that, you could just pop the tendon, and that should stimulate healing, and that patient will get relief. And I've actually seen patients getting relief from this. Now, what about insertional Achilles tendinitis? If a patient has been suffering for long, what we do is we open here, bang in the middle, we detach the tendon, we shave off the bump or the Hagland's deformity, and then we reattach the tendon. That's one way of doing it, all right? And the patient will get relief. I always warn the patient, though, that this may take a long time to heal. It can even take 6 to 12 months to heal. Another method that we could use to treat it would be to make an incision over here, okay, and to cut the bone and to shift the bone a bit in the front, known as a Zadex procedure, and that will be able to relieve the pressure on the back, and the patient will get relief. So those are the ways that you can deal with insertional Achilles tendinitis. Thank you very much.